I'm Henry Ellis from Scottish Rite Sports Medicine Center, and I'm going to talk to you a little bit about what you can do as a coach to influence our kids. I can tell you, as a father of two kids who play sports, the coach can be one of the most influential person to not only the kid, but the family. But let's talk about some ways that you can influence them on some healthy sporting activities. First off, what you may or may not know is overuse injuries are up 600%. Well, what does that mean exactly? Well, to an adult, that may be a little tendonitis here and there, but to a kid, it may mean that you have inflammation of your growth plate. The most common we see is in basketball players is Osgood-Schlatter, right over the shin bone close to the knee. Sometimes kids have a little bump there. Well, you can see on this x-ray, it's outlined in red how sometimes you can grow an extra bone, and truly the growth plate goes through an inflammatory process and it's very, very painful. Sometimes it could be a little bit more permanent. So you really want to be sure to talk to the kid about taking a break, proper stretching, and sometimes anti-inflammatory medication. But most importantly, as a coach, you need to tell them it's not dangerous to have it, but that they need to take a break and rest and let that growth plate resolve the inflammation. It's truly overuse. So just taking a break is the best solution for it. Other injuries are also up. And let's just talk about one really important one, ACL injuries. You can see here multiple different studies have demonstrated a huge increase in ACL rates in our kids, and this is a problem. The real problem is because we have injury prevention programs and parents sometimes are not aware of them. In fact, in this survey that I'm presenting here shows that somewhere between 20 and 30% of parents across all different athletic types and levels of competition are not aware of injury prevention programs for the ACL. Now, this is paramount for you as a coach to implement this in your program, but also for parents to insist upon it within their club, their school, and their coaching staff as well. I'm going to go over 3 rules, or at least 3 strategies for you to educate your kids when you're a coach. Number 1, sports specialization. Well, what does it mean? Well, it's really year-round sports. You pick one sport over all others, and you quit all other sports. We really emphasize the need for an off season because, professional athletes, collegiate athletes, they all have an off season. So why don't we expect our kids to have an off season? Well, this is a problem here. And I'm going to quote this article here, which is a recent article in Sports Health talking about sports specialization in our kids. Now, this is 13 to 18-year-olds, and you can see a significant amount of them chose to choose one sport, and that was basketball. But what's most important in this study is that above 50% of them were physically exhausted, and 45% of them are mentally exhausted. And these are our kids. You got to tell them that sports specialization, or more important, having an off season is really important in the growth and development of a young athlete. Number 2, the 70-30 rule. This is my favorite rule. This means you need to spend 70% of your time training for your sport, 30% of your time doing something else. It can be recreational or it can be conditioning for your sport. Now, Malcolm Gladwell in his book, Outliers, popularized the 10,000-hour rule that the more you practice, the better you're going to be, right? Well, David Epstein in his book, Sports Genes, told us that maybe it's not all practice. Perhaps it's a little nature, nurture, perhaps a little genetics are involved. Well, the answer is it's probably somewhere in between. It's probably a combination of both of them. Practice is good, but sometimes you're just born with it and sometimes you're not. And that needs to be of consideration as well. In fact, when you look at the article that Malcolm Gladwell quoted, looking at the 10,000-hour rule, he found that not only hours of practice were helpful, but equally as important statistically is sleep. The more you sleep, the more likely you will have the skills to be an expert in whatever you do. And that study was on violinists, by the way. The 70-30 rule, look at it here. What it really means is 70% of your time should be spent playing your organized sports, 30% of the time should be spending doing something other. Well, what does that mean? Well, it means that 10 hours a week you may be doing organized sports, and if so, then spend 4 hours a week doing something else, and that can be conditioning, strength training, something else for that sport. Third rule I'm going to go over is prior injury. Well, what do you do with an athlete that comes back? Most common thing I get as a surgeon is the athlete cleared? Can they go back and play? Are they cleared? I need a clearance note, doctor. Well, it's important for you as a coach to realize that an injured player to a healthy player is not black and white. You don't go from being uninjured to being healthy just like that. It's not just a clearance letter, and really the answer is somewhere in between. In fact, there's a little gray zone in between them. And the gray zone sometimes is much bigger than we think it is. So sometimes you can be cleared to go back, but that doesn't mean you go back at 100%. I recommend a tiered process where you start off with 50, 75, and 100% with 2-week intervals. That's 50% of the game, 50% of practices, 50% of the intensity, and then 75 if they're doing really well after 2 weeks, and then 100% thereafter. Depending on the injury severity will depend on how fast that they can went through this progression. But it's important to know that being injured and then being healthy is not black and white, and there's a gray zone in between.